Hi, my name is Dr. James Maggio. I'm a chiropractor who practices in Virginia Beach. One of the most common health issues that we take care of in the office is for people who are suffering with headaches. There's over 329 different classifications on why people actually get headaches. That's why it's such a confusing health issue. I want to demonstrate to you one of the most common reasons why people actually get headaches, and it's because of a condition called pinched nerves. Most people have heard of pinched nerves before, but they really have a hard time understanding it. So I'm just going to demonstrate this to you with a couple simple tools. If we look at a person's spine, in between each bone, or called vertebrae, are joints that allow the vertebrae to rock back and forth nice and smooth. As long as the vertebrae rock back and forth smoothly, there's very little pressure on the nerve, and then the person feels good. But sometimes what can actually occur is the vertebrae can get stuck and jammed right on the nerve, in essence, pinching the nerve. Once again, good mobility out of the spine makes you feel good. Poor or locked mobility causes pain. Let's look at this on a computer-generated model. If we look at this simple screen here, what I was speaking about a moment ago is how these vertebrae should all be moving really, really well. Here are those nerves that come out in between the vertebrae. If the vertebrae gets stuck, it pinches the nerve, and then wherever that nerve goes can cause pressure. And in this case, if someone has pressure in the top of their neck on a nerve, it will simply cause headaches. We have a remarkable tool in the office called the Proadjuster Vision. It's made by a remarkable company called Polestar, and it's something that I've had the privilege of using for over 15 years. This is the instrument right here. It's hooked up directly into the computer, and we actually run this over the person's spine to check how well their spine is moving. When we do an analysis with them, we get an instant reading that looks just like this. So for example, you can obviously see where these are flagged in red. Where we have red flagged on the vertebrae means that the joint is not moving and it's pinching the nerve. If we see this on a person's scan in the area that radiates up into the head, then we found the cause of their headaches. The other thing that's remarkable about this Proadjuster instrument is that once we do the analysis on the person, we can actually use it to treat people. Some patients who are under chiropractic care like the turning, popping, and cracking that I can do upon request, but most of the patients we see actually prefer to get treated with this. The way this works is we put it right on the spot that's stuck, and the instrument fires into the vertebrae at a remarkable speed of up to 90 times a second. As soon as the computer gets a reading that the vertebrae is moving better, then it shuts it off. And here's the last thing about the instrument that we all love, is after we do the treatment, we can do a new analysis to make sure that that red's gone and that the person had a good result. I want to thank you for your time and attention on watching this brief video on headaches. And if you or someone you know are suffering with headaches, feel free to call us at the number listed on the screen. Once again, my name is Dr. James Maggio. We'll see you soon.